Hi, this is Kyla. I'm a first-year nursing student. I'll be doing cardiovascular assessment in this video. So cardiovascular system is a system in our body that supplies oxygen and nutrients which are needed to do our daily activities. So the first thing that we need to do is to review the client's medical record to determine the scope of assessment needed and prepare the necessary materials prior to meeting the client. So for this assessment, we'll be needing a rectangular card and a ruler to measure our jugular venous pressure. Next is our pen light. And lastly, our stethoscope to auscultate heart sound. So before having contact with the client, let us perform first a hand washing to prevent cross-contamination.
I'm a sucker for your love, even though it's kind of toxic, babe. You know I feel it when we touch.
Hello ma'am, good day. My name is Kyla. I am your student nurse for today. So we will be doing a cardiovascular assessment. So before that, may I ask for your full name please?
My name is Auntie Thomas.
And your birthday ma'am?
April 2000.
And how old are you?
15.
Alright, so what do you want me to call you ma'am?
Please call me now.
Okay, so Miss Anne, I'll be with you for the cardiovascular assessment. And with that, I'll be touching some parts of your body. I'll be palpating for your neck, your arms, and your legs. And also, I'll be auscultating for the heart sounds. Will that be fine with you?
Yes.
Okay, so do you have any questions or clarifications before we start with the assessment?
No.
Okay, so rest assured that all of the data or information that we've gathered will be kept confidential within me and the attending physician. Okay, so before that, how are you feeling today?
I'm fine.
Have you experienced any shortness of breath?
No.
Alright, so any dizziness?
No.
How about headaches?
No.
Okay, so have you had any history of heart disease?
No.
How about anyone from your family?
None.
Okay, so do you smoke?
No.
Alright, so I'll be at your right side so that I'll be closer to the right side of your neck and I allow you to you recline around 30 degrees to promote normal breathing during the procedure. Alright? Okay, so now I'll be shining my pen light to check for your neck and can you lift your neck towards the left? Alright, so the other side. Alright, so ready. So your jugular vein is flat and without distension. And if ever that I have found any distension, I'll have to locate the moist and low point of the distension on your internal jugular vein. And if needed, I can also lower and raise the bed to help with the observation of the distension. Alright, so this time I will be measuring your jugular venous pressure by measuring the sternal angle on the right angle using my ruler and this rectangular card. So can you lift your head? Alright. Okay, so this time I'll be palpating your neck. So can you lift your head towards the left? So I'll be palpating for your carotid artery. Okay, so now I'll be auscultating for your artery using the bell of my stethoscope so that I can hear a low pitch sounds. Okay, so can you inhale, exhale, and then hold. Okay, relax. The other side. Can you please inhale, exhale, and then hold. Okay. Okay, so I haven't found any carotid fluid bilaterally on your carotid arteries. Alright, so for the next part of the assessment, I'll be inspecting and palpating for your pericardium on your chest area, and I'll have you to expose your drape one chest up to the other. So can I lift the drape now? Okay, so I'll be I'll be I'll be inspecting for your chest, your aortic, pulmonic, tricuspid and apical areas. Next step, I'll be palpating for your hinge. So I'll be placing my fingertips obliquely on your sternal border and the apex. Alright? Alright, so this time I'll be palpating for your trills or the vibratory sound caused by vertebral flow on your chest. So I'll be using the bow of my hand to palpate. Okay? Alright, so I haven't found any vibration. So this time I'll be palpating for your tricuspid, aortic, and pulmonic. Alright, so I have already checked for your impulses. So the next impulse will be the apical impulse. So I'll be palpating to the apical areas using my 3 fingers. Okay, so I am able to palpate any impulses in your apical area. So I need you to roll towards your left laterally. Alright? Can you please roll towards your left? Okay, so I'll be palpating for your upcoming impulse. So can you please inhale, exhale, then hold. Okay, so you can roll back now to a supine position. Okay, so even though I haven't found any impulse on your apical area, there is no problem. That is still normal since it is completely normal not to feel any apical impulse. Alright, so this time I'll be palpating for your epigastric area. So it's right under your sternal border. I'll be using my 3 fingers. Okay. Alright, so this time I'll be assessing your heart rate. So using the diaphragm of my stethoscope, I'll be placing it on the apex. And right, so I'll be assessing for the rhythm also. Alright, so heart rhythm is completely normal or regular. So this time I'll be auscultating for the high pitched sound on your aortic, pulmonic, tricuspid, and your apical area. Alright? Okay, so now I'll be using the bell of my stethoscope for low pitched sounds. So I'll be doing the same thing. Okay, so I'll be repeating the steps earlier, but this time I'll be needing you to place laterally on your left side. Okay, so I'll assess you now to a sideline position. Okay, so I'll be using the diaphragm of my stethoscope toward the high pitched sound. So I need you to inhale, exhale, then hold. Okay, inhale, exhale, then hold. Right, inhale, exhale, then hold. Then inhale, exhale, hold. Alright, can relax. This time, I'll be doing the bell of my stethoscope for the low pitch sound. So I'll be doing the same thing again. Okay, so you can please inhale, exhale, then hold. Inhale, exhale, and then hold. Inhale, exhale, then hold. Inhale, exhale, and then hold. Alright, so you can lie down now. Alright, so for the next assessment, I'll be assessing for your peripheral vascular system. So this time, I'll be moving from your upper extremities toward your lower extremities. So may I have your hands lying down on the bed? Okay, so I'll be inspecting for any lesions for the skin discoloration, and the symmetry of your arms. So I'll be palpating for the temperature. Alright, so the temperature of the skin is warm to touch, and dependent position claims strips of distension of the veins, and when it's elevated, the veins collapse. Alright, so for this time, I'll be palpating for your ulnar, radial, and brachial pulses. Okay, so first is your radial, then your ulnar, and your brachial pulse. Okay, so I'll be doing it on the other side. Your radial, then your ulnar, and your brachial. Okay, so pulses are full and symmetric. I will also be checking for the capillary refill. Okay, so may I have your hand? Okay, so cup refill is both less than 2 seconds. Okay, so for the Allen's test, I'll need you to close and open your hands as quickly as you can. Okay, okay, go. Okay, close. We'll be removing the radial. Okay, so open and close as quickly as you can. I'll be cleaning the radial and ulnar. Okay, close. I'll be removing the ulnar. Okay, so alright, so that's it. So I'll be doing the same thing on the other hand. Alright, so now that we're done on the upper extremities, we'll be moving on to the lower extremities. So first, I'll be assessing for your peripheral vascular system on your lower extremities. So I'll be observing for your any symmetry, for the symmetry of your legs, and for the skin for any lesion, and also for the temperature if the skin is warm to touch. Okay, and I'll be checking also for the edema. So I'll be pushing in this area. Alright, so there is no sign of edema. So I haven't found any edema and no lesions found. And also, the skin is warm to touch. So in a dependent position of limbs, there is distension of joints, but when it's elevated, the distension collapse. So for this time, I'll be palpating for your pulses. So first for your femoral, then popliteal, dorsalis pedis, and then lastly to your posterior tibialis. So I'll be checking for the femoral pulses now. Then to your popliteal. Okay, so I'll be checking also for the posterior tibialis. And then to your dorsalis pedis. Alright, so I'll be palpating for your pulses on the other side as well. Okay, so for the last test, I'll be performing a Human's test. This will use for checking the deep vein. Alright? So what I'm going to do is the dorsiflex of your leg on your foot, so to check for your counts. Alright? Okay, so I'll be doing on the other side, the same thing. Now I'll be checking for the capillary refill. The cap refill is both less than 2 seconds bilaterally. Okay, so I think that's it for our assessment for today. So all of your vitals are normal, and I haven't found anything abnormal regarding to your cardiovascular system or your cardiovascular health. Alright, so if you feel anything unusual later on, you can just push the call button for the nurse to arrive. Alright, so thank you, Miss Anne, for being cooperative, and you have been a wonderful patient. So see you around. Now that we're done with the assessment, after touching the patient, we have to perform hand washing as an aftercare. And that's it for my cardiovascular system assessment.